Welcome to the Access Fee-for-Service Provider Training presentation. This video is a short presentation for behavioral health residential facilities, provider type B8, and during this presentation will be referred to as a BHRF, BHRF. BHRFs are reimbursed at a per diem rate for a 24-hour time frame, and services provided by the BHRF are submitted to Access using the HCPC code H0018. BHRF providers will often have questions regarding what services they can and cannot bill outside of the daily per diem. Access Medical Policy 320V, titled Behavioral Health Residential Facilities, outlines the specific services that are expected to be offered by the BHRF. First, we will show you how to navigate to the Access Medical Policy from the Access homepage. First, select the link titled Resources. On the right-hand side of your page, select the link Guides, Manuals, and Policies. Next, scroll down to the Access Medical Policy Manual. Select that link. Scroll down to Chapter 300, titled Medical Policy for Covered Services. Select that link. Scroll down to Policy 320, titled Services with Special Circumstances. Select that link. And then scroll down again to the bottom of this page and select the Policy 320V titled Behavioral Health Residential Facilities. Select that link. Now we have navigated to the Access Medical Policy Manual, Section 320V, titled Behavioral Health Residential Facilities. Now we're going to scroll down to Section F, number 11. Section F of the Access Medical Policy 320V is titled Admission, Assessment, Treatment, and Discharge Planning. Now we're going to scroll down to Section 11. AMPM Policy 320V for Behavioral Health Residential Facilities, Section F, number 11, lists out the services that must be made available and provided by the BHRF. These services are considered covered under the per diem rate and cannot be billed separately. If the service is listed within this section and does not meet exclusionary criteria, then it cannot be billed separately from the per diem by the BHRF. Services deemed medically necessary through the assessment and/or CFT, ART, or TRBHA, which are not offered at the BHRF, shall be documented in the member service plan. And very important, that documentation shall include a description of the need, identify goals, and identify provider who will be meeting the service need. Sections 11A goes over group and individual counseling services. Section 11B covers services, skills, training, and development. And Section 11C covers behavioral health preventions, promotion education, and medication training and support services. It is the responsibility of the BHRF to adhere to the requirements specified in Policy 320V to ensure that all services the member is entitled to receive are provided and that the BHRF is in compliance with access policy and guidelines. This concludes this presentation, and thank you for watching.